Evidence-based practice has three components: best external evidence, patient values and expectations, and individual clinical expertise. And there's 5 steps to it, to the patient-centered. 1 being ask, formulate a clinical question. That's where PICO would come into play, which I will discuss further later on in the video. 2, acquire, searching the evidence. 3, appraise the evidence. 4, being apply evidence into decision making. And 5, assess, adjust, which would be evaluating the process. And the process includes assessing the patient problem, asking a clinical question, acquiring evidence, using the appropriate resources, evaluating the evidence, and then applying to practice. And then the cycle would just keep continuing. And when talking about the clinical question, that's where PICO would come into play. P standing for the patient or problem, I, intervention, C, comparison, O, outcome. For the patient or problem, it would be, for example, if the patient had a wrist fracture or something of that sort, you would put there the wrist fracture. I, intervention, what type of rehab or exercises you're planning to do for that. C, comparison, if they could use a sort of wrap or a little brace for their wrist. And then O would be the outcome, meaning that you would want to have a reduction in the symptoms. And then some of the researches would include meta-analysis, systemic review, and randomized controlled trials. Those are the top 3 ones. And there's also cohort studies, case control studies, case series, case reports, and animal research. And you can go to pedro.org, and this rates the different types of articles to see like what's better.